Let's go further in depth now. Joining us by telephone, Congresswoman Marsha Blackburn. Marsha visited the CDC on Friday and called for a review of all travel protocols following that meeting. We're also joined via Skype by Tevi Troy, president of the American Health Policy Institute. Tevi's also a former deputy secretary for the U.S. Department of Health and Human Services. To you both, good morning and welcome to America's Forum.
Thanks for having us.
Good morning. It's so good to be with you. Thank you.
You bet, Marsha. It is good to have you. Now, we heard yesterday about the first case of Ebola transfer, not in Africa. Bogman's news update. A nurse caught the disease from a man she was treating. So, Marsha, let's start with you. Increased screening. Is that a step in the right direction? And is that one of your recommendations for here in the United States?
Yes, indeed it is. And when I visited with the CDC on Friday and with Dr. Frieden, that was one of my questions. I said, it only makes sense to me that we would increase our travel precautions and limit travel and maybe put a stop on non-essential travel in and out of the region. And here's the reason why, JD. So many of us who are parents have taken a child to school in the morning, and then noon, 1 o'clock, you get a call. The child has a temperature. Come pick them up. They've gotten sick. Now, what we don't know is what happens with those passengers in transit. We're relying on individuals to self-report their activity, to fill out the form correctly. We know that Mr. Duncan did not do that. We know that people have their temperature checked before they get on the plane. But what happens during these long-haul 12, 15, 18-hour flights? Someone can become ill during that. So I said, well, why don't we have some quarantines and some protections in place when people come to immigration services.
Point well taken, Marsha. I hate to interrupt, but I think you've outlined it well, and for interest of time, let me move to Tevi. Tevi, you heard what Marsha Blackburn had to say, not only screening, but banning some travel. Do you agree?
I definitely think we should be increasing our screening protocols and taking a careful look at it, as the Congresswoman said. I think that we do have internal plans for banning travel from certain countries. I think it's premature to do an outright travel ban. The disadvantages outweigh the advantages at this point, but it's something we should have on the table, and I don't think we should say that it's something we're not going to consider.
About a minute 30 remains in this particular portion of our program. We're going to continue the discussion on the other side of the break. But Marsha, in the time remaining, you made the trip down to the CDC. After your visit there and a look around, in your opinion, are we prepared? And most importantly, I guess, is the CDC prepared to deal with whatever comes with Ebola?
The CDC seems to be convinced that there will not be an outbreak in this country. I think that containment is going to depend on the work that they do both in Africa and here as people immigrate to the country, and to be certain that hospitals are prepared and state health departments are prepared, and you don't have a situation like occurred in Dallas at the hospital with someone being turned away. So my hope is that the execution of their plans and their research and the work they're doing in the labs will keep pace with the disease, and also that the vaccine production the pace on that will be picked up.
Fair enough. 20 seconds for you, Tevi. Should there be a so-called Ebola czar?
Well, it seems to me like at this point that Dr. Frieden is that Ebola czar. I think CDC has the capability to prevent Ebola. I just think that it's really contingent on them doing the right things. So, for example, in the Dallas case, the right things were not done, and that's why we have this flare-up over there. So as long as our public health system and our public health workers do the right things, we should be able to control this.
Fair enough. We will continue our discussion after the break. Stay with us because Marsha Blackburn and Tevi Troy are. America's Forum continues here.